we're doing a case on a patient who's had surgery in the back. It's called failed back syndrome, and we're implanting a neurostimulator. The first thing I'm going to do is numb the skin up. This is lidocaine with epinephrine, little needle stick. Here's a stick. Now this big machine right here is an x-ray machine, and I'm taking all these pictures so I can see exactly where I'm going. This is a device, Bovie cauterization. Allows me to kind of open up a pocket here and maintain good hemostasis, meaning not losing too much blood. The initial process of an implant is just creating the two pockets, the pocket for the leads and the pocket for the battery, which is what I'm doing down here. Now, this patient has decided to go with a non-rechargeable battery. The advantage of a non-rechargeable battery is that you can just leave it and forget about it. You have to replace the battery every 2 to 3 years based on usage. So this is a non-rechargeable battery. It's a little larger than a rechargeable battery, but this is the size of the device. So I'm taking a needle. Again, these are the needles with the wires through. It's a needle that has a stylet, which means it's hollow. As I'm getting to the window, which we call the interlaminar window, where we have access to the spinal cord, this is called a loss of resistance. I'm going to put this needle right next to the canal. A little bit of pressure. If I had loss of resistance, I'll get a wire. Thank you. And these are the leads that we're going to put in again. I guide these leads. Those electrodes are on the top. 8 contacts in each, total of 16 contacts, 16 wire, 2 wires with different electrodes that can give us a wide range of programs. So these are anchors. So once we put the wires in the back, we want to make sure that they don't move. So I anchor them in. So you can see there's a mini screw right there. So I put the wires through this, and then I screw it to the body, which lock that up. Now the next step of this procedure is, so there are 2 surgical openings, one here and one on the side. So these are the 2 little leads coming out of the spine, and we have the device anchored or tied down. Now the next step is we're going to go to this second site where we have created a little pocket here, and I'm going to put the leads in there. We do this with the tunneler. Now the 2 wires are here, and I'm going to put this through this clear plastic sheath, and Mel's going to help me get it onto the other side. There we go. Perfect. That was a test telling us that all the wires are in the right place and everything's looking good. So now I put this into the body. So this way we have the whole system, the leads, the wires, everything underneath the person's skin, and they get some good relief from their pain.